Thank you. So yeah, if you have a question or if I'm moving too fast, when I get excited about a topic, I can talk kind of fast. So just let me know, and yeah, we'll get started. So again, I'm Tracey Bastiaans. If you see me out and about, please call me Tracey. Do not, I won't always like listen to Dr. Bastiaans when I'm not in the hospital. So if you keep saying it and I'm not responding, I'm not ignoring you. It's because for the past like 10 years now, I was always Tracey. So the whole Dr. Bastiaans, even though I've been a physician for a while, as a resident and fellow, you were called by your first name. So I'm still getting used to it a little bit. I'm just gonna make sure I'm doing this correct. So we have a new laser at our office, and it's called the Fraxel. So what exactly is it? It's a non-ablative laser, which what's great about that is you have little to like no downtime, really. Like you can get it done. I do these on Fridays, but really we're hoping to start adding these on Mondays as well, afternoon. You can even go back to work the next day if you're okay with having a little bit of peeling at work. You can still wear makeup with this right after we laser you. So it's not one of those things where I'm like, oh, you can't wear makeup, you can't cover up if you're peeling. You can. So it is a safe laser that basically helps not only with resurfacing, like it says on here, but there's multiple other things it can do that we're gonna go over. And it's non-ablative, so the downtime is really minimal to none. So basically, as you age, we get more, fine lines and wrinkles. We get kind of more leathery, coarse texture, especially if sometimes if like you're a smoker, you do have more fine lines and wrinkles and that more coarse, leathery skin. You see dry scaling and roughness, irregular pigmentation or dyspigmentation. Where you bruise easier as we get older. You can get telangiectasias, which are broken blood vessels. And this laser treats all that, which is outstanding. The next slide just kind of shows anatomy of the skin. This is more for people who are nerdy like me, who like to see what it is. So your skin itself is multiple layers. The epidermis itself actually has 5 layers and the dermis has 2. So the big areas that we're treating here is we're actually, with both types of, the laser itself has 2 treatment options. So in both of these lasers hitting the epidermis and the dermis, and then another setting is hitting really the deeper dermis, but not so deep that you're not scarring from this. So it's not a full thickness laser, but no laser should be, because that's actually what contributes to scarring issues and inappropriate use of a laser. So this is actually what it looks. That's actually what it looks like. So it's pretty small. What I like about the laser itself as a physician, it's very, very safe. So if I'm not on your skin holding the pedal, it is not going. So I could like go like this and still be on the pedal, and it's not beaming everywhere. It's like not zooming around the room. Like our CO2 lasers, if you're on that, you could hurt someone. So this is very safe because you have to be touching the skin surface for it to actually activate. So I love how it's very safe, and it has little rolls on it, just rolls on the skin. Some lasers, they're more like laser point. This is just kind of just rolls right over your skin and activates energy. So like I said, there's 2 treatment options. It's a dual laser, so you can actually do dual treatments at the same time too. So you have the 1550 and the 1927. Smaller wavelengths like the 1550, that penetrates deeper. I know it's kind of almost reversed. You'd think a higher number would penetrate deeper. It's the opposite when you talk about wavelengths. And then the 1927 is more superficial epidermis and superficial dermis. So that's what's great about this is there's it's both all the same price, but you can have dual treatment, or we're going to talk about next kind of what each wavelength treats. So basically with the deep mode, which is a 1550, this is more for people who want to treat fine lines and wrinkles, surgical scars, melasma, which is that pigmentation after childbirth. Some people who don't even have child, but you have, your hormones are out of whack, you can still get malaria from that. That's a deeper wavelength. And usually with a deeper wavelength to see improvement, it does usually require like 3 to 4 treatments to treat fine lines and wrinkles, surgical scars. That wavelength though still also helps with hyperpigmentation issues, especially hyperpigmentation issues that are deeper in the dermis layer, like melasma. Melasma doesn't rise superficially like our age spots. That's deeper in the skin. And then our superficial mode, it basically helps, it acts almost like a resurfacing. So it kind of gets your pigmentation very nice and even. It's smooth. What's nice about that, even though it's not deep, it also treats premalignant lesions called actinic keratosis. So if you have a bunch on your face, a lot of dermatologists, they're like, oh, I'm like cutting everything out all the time, or they have you on a topical medication that's like for cancerous lesions. But what's nice with this is this actually treats it. So it's kind of like a one and done until they re-arise, it's treated. And that's what's great about this laser. It's a treatment laser. So when I say you need this many treatments to see results, it's treatment. It's not maintenance. So if you take good care of your skin after you get treated and you're happy, you're like, okay, I'm done. This is the results I want. As long as you take good care of your skin, you will still see these results. It's not. There's a lot of maintenance lasers out there. I did not think that's appropriate. I think that's a waste of people's money. So this is a treatment laser. You can, like I said, depends on what you're wanting to achieve and what we're trying to achieve together with your care on how many treatments you need. I usually do, I know the company says 2 to 6 weeks. I really like waiting a full 4 weeks. The reason why, especially with the one that penetrates deeper, the deeper laser is trying to stimulate collagen. So you're gonna see changes in like your surface and pigmentation right away, but it's gonna take a few weeks to actually see the results of helping your wrinkles because that's collagen production. Collagen takes weeks. So I usually try to space out those patients who are not working on resurfacing or hyperpigmentation. I space those out about 4 weeks so you can start seeing it so that you don't think I'm just taking your money because you want to see results, right? And like I mentioned before, wound care is very minimal, but you can get some, scaliness, some bronzing, some peeling with both. You see it more with the superficial laser because it's almost acting like a chemical peel in a way. So is it safe? It is very safe. Fraxel has been around since the early 2000s. It was actually the first non-ablative laser in the cosmetic or plastic surgery world. Most commonly, you are going to get, so it says most common side effects, you are going to get red, you are going to get swollen. I've never seen someone not react. I actually see immediate changes in your skin, and you can feel it. It feels like a sunburn. That's what it feels like. And it looks like a sunburn when you leave my office. Other side effects you can get itching. You probably will when you peel, dry skin, peeling, flaking. Some people do experience prolonged redness and swelling. Right now, in the handful of patients I've done, I would say usually all the swelling and redness has been gone about a week to 10 days after the procedure. Blistering is very rare, but yes, it can happen. Scarring, unfortunately, yes, if you're not using correct settings or the darker pigmentation you have in your skin, you can actually, if you're someone who like keloids or scars easily, I actually won't do this treatment on because it actually can make your hypertrophic or keloid scars worse, and it can actually permanently scar you. So there's certain times where I can't use it on certain things. I said it does treat scars, but it can't treat your scar if it's already like hyperpigmented, raised, like keloid scars, that like the ones you see a lot like on the earlobe when people like pierce the ear and it's trauma and it's like a little keloid. I can't treat it with that because it will actually make it worse. There is a risk for infection. I do kind of go crazy with the alcohol on you, so I apologize about that because I want to help prevent that. Hyperpigmentations, while it does treat pigmentation, people with darker skin tones, it can actually cause hyperpigmentation. So we have to be very careful with certain settings. If you're someone who's like, I want more even skin tone, but I have darker skin, we'd use the lower levels to achieve that. And also, if you've had a history of HSV, also known as herpes, it can reactivate this. If you have had a history, I actually usually put you on Valtrex to prevent this from happening because it can reactivate any cold sores, infections that you've had in the past. Also can flare your acne as well if you have adult acne or rosacea. So this is great. These are great slides. I wish, can we make that darker so people can see that better? I don't, can you guys see that? I feel like it's not as impressive as what I'm seeing as up there. Sorry. So I said before, the Fraxel 1550 works on more like deeper skin problems like wrinkles, scarring. It basically, this is what a patient looks like. So for this patient, you can tell what I know just from looking at the results, she was someone who probably was working on basically her pigmentation issues. Definitely, she's some hyperpigmentation. That's the top one on the top left is like before we did the treatment. And this is not my patient. This is like a Fraxel patient who did it through the company. And then right away afterwards, so you do get that rosy look, and that's with both types of both wavelengths. You're gonna get rosy and red like that. That's why I actually put you on sunscreen on you before you even leave the office. And then you see at 5 days, oh, that's right, that's below. So 2 days, 3, 4, 5, and then a whole month. And you can tell, what I actually appreciate is you can tell right through here, her pigmentation is much better. She has decrease in her fine lines and wrinkles as well. Not drastic. She had really good skin to begin with in regards to like wrinkling, but you can tell her pigmentation is a lot more even than it was before the laser. The next one, I actually love this one because it's a lot more impressive in like the pamphlet they give you for it. So you can tell she's someone who has a lot of like, basically she has a lot of sun damage on her skin, a lot of hyperpigmentation throughout, a lot of freckling throughout. You can tell by 1 week after, all that freckling is gone. And I think that's, to me, that's after just one treatment. That's, to me, very, very impressive. And that's why a lot of times, if that's what you're trying to treat, it's a one and done then. This is a treated laser. So if she didn't want any more, she didn't want to work anymore on her resurfacing or pigmentation, I think that's a great outcome for this patient. They picked the right person to show in their, in their slides. This is a patient around the periorbital region. It works really well for fine lines and wrinkles, as I said. We try to really target these areas because a lot of people complain. A lot of people are like, oh, I don't like my crow's feet. I want to decrease how much Botox I'm using. So we can do it periorbitally around the eyes. So this is before treatment. And then side by side, before and after. This person did require, though, 4 treatments. And this is 3 months after her last treatment, how it looks. So it does take some time to treat the fine lines and wrinkles. Yes, you do need to have more than 2 treatments to see the results you want, the benefit of the laser, because it's deeper in your skin. This is another patient who you can see she has some hyperpigmentation. You can see some wrinkles around her lips, on her cheek. And then this is after 4 treatments, 6 months after 4 treatments. So you can see those fine lines and wrinkles on her cheek are pretty much really minimal. I mean, you can still see it more periorbitally, but those ones that were higher up on her cheek, those are gone. And her hyperpigmentation is much better too. This is a patient who, I believe when I asked them what was for, this was like part of it, some of it was acne scarring. She definitely has melasma, so that's an example of what melasma looks like. A lot of times you see it after pregnancy or during pregnancy. For some people it resolves, for some people it doesn't, so they want to get that fixed. And then this is after 4 treatments as well with her. Her melasma is pretty well controlled. I feel just immediately by her nose, I still see a little bit of changes, but her cheek looks so much better than it did before. Another patient, I don't think this is as impressive. He does have some hyperpigmentation, but overall, like, he has decent skin quality, but then you can tell it also helped resurface his face as well. So his face is a lot more uniform in color. And I guess it helped a little bit with his wrinkling. You can see, like, just below his eyes, below his lid, he had some wrinkles, and you can tell now, like, that pretty much got rid of it. So that did help him around the eyes too. Another example. I'm gonna skip ahead because I think you're kind of getting. And then this is an example of acne scarring. So a lot of people deal with this. Absolutely, it's as a kid, it's horrible. As an adult, you can have acne and have issues with it. But this is actually, I won't laser you if you're having a flare-up. But if you have acne scars and they've been stable, then we can laser you. And then this is a patient after 1 month after 5 treatments. So you can definitely see a lot less pitting. She has a lot less pitting present. And her skin looks much better, and she's much less, self-conscious about it. The next one to me I actually love. It's a surgical scar, or it could even be a traumatic scar that's not hypertrophic or keloid. This is a patient before, and I think her results are very impressive, and that's after. Yeah. So she had, and this was just 3 treatments. So it does, like, it's very beneficial for surgical and traumatic scars that are not hypertrophic or keloid. Here's another patient. One of my favorite areas to treat too is the neck and the décolleté area. A lot of that's where we have a lot of sun. When we're laying out, we get more age spots there. So I really like actually treating this area. And this is a patient before, and this is a patient after. I don't like the lighting on it. It's not, to me, as impressive, but you can tell her skin tone is lighter. It evened out her skin tone better. It even worked on her wrinkles of her neck. That's what I actually appreciate the best, is it did a really good job almost tightening the skin of her neck too. So while you can't say it's going to tighten your skin, it does help with that because it's a heated source. Anytime something's heated, just like if you put a match next to a leaf, not on the leaf, but next to it, it crinkles. That's essentially what heat does to your dermis. So it's tight. It acts like skin tightening, even though we can't say, oh, that's what it does. but it essentially does do a little skin tightening as well because of what the mechanism of action is. That's another patient of her décolleté area. That's always very impressive, looks very nice. She had a lot of, sun damage on her skin, and it kind of got rid of all that hyperpigmentation and skin damage. And for all we know, maybe she had some actinic keratosis because a lot of skin damage, it's treating that at the same time too. Another popular place is hands. I always feel that like our hands can really make us look aged even if we're not, because a lot of times it has to do with how much we're, our hydration status, but a lot of times we can't fix pigmentation with hydration status. So this patient was treated and they were about 3 treatments. This was a month after the last treatment. I think that's a good result too. It's a very good result. And it also offered her some skin tightening as well. Here's another patient. So this one, now we're actually starting at the 1925. So what that is, that's more facial resurfacing, irregularities in the skin, and hyperpigmentation. It doesn't hit as well as the fine lines and wrinkles, so you won't see as much as impressive, but it can help a little bit with some, just because it's a heated source. But it doesn't, the 1927 does not, we can't say it's gonna treat your fine lines and wrinkles. It's more superficial and like resurfacing of your face. And that's after. So I do think around her chin, it may be the way she was pressing up against it. She might have had a little bit of benefit from wrinkling, but I think she's pressing down in one of it, so you don't look at that part. You gotta look at her like just overall, like her pigmentation's much better, she's a lot more even, and then unfortunately we can't feel her face, but she should have benefits of resurfacing of her face too. Here's another patient with a 1927, and I don't know why, but they did it 1927 with a scar. You should really do the 1550 with a scar, so I'm kind of surprised they showed this. And I don't think it's that as impressive as we saw what the 1550 wavelength can do with a scar. So even if you didn't want the deeper treatment and you just want more superficial, it can still help treat over a scar, but really the benefit that this patient got to me was the hyperpigmentation. You can tell that she's not as hyperpigmented with freckles everywhere anymore. I mean, there's still some there, but to me, she got more benefit treating that than treating just the scar itself. We got another hand one that's really good. I thought that one was a really good, impressive one too that they sent us. One of my favorite ones is this is another patient who has a really, you can tell she's probably for a while, she might have even been born with it. She basically has hyperpigmentation of her skin. It's not melasma, but she probably was a birthmark that she was born with, and then as an adult, and then she got treated. So to me, it's really impressive after 4 treatments because that's a pretty that's a very large pigmented lesion. So she was treated with the laser with that. And then you can also do a dual procedure. I mean, at the same time, I can be working on your facial resurfacing and deep scars deep scars and wrinkles at the same time. So you can do that. I haven't done enough people on my end to know like if you should just really do one or do the other, but the company does boast you can do both at the same time. So I thought she had a very good result. Like her cheeks are much, much better. Her perioval region got hit, and around her lips, like look at, she doesn't even have those marionette lines that are pretty deep there. She doesn't really have them anymore. And then this part, I always feel weird. I don't do the price, but then I guess that's I guess what we're charging right now. So what I really like about this laser, it's very, very safe. And it's a treatment laser, so it's not something you have to come back multiple times and have done. If you're just looking for something superficial like your hyperpigmentation and resurfacing, I've had patients only need to come once. If you're looking for surgical scars or traumatic scars or deep fine lines and wrinkles, it is going to take like 3 to 4 treatments. So you have to be realistic about it. It can for that, but as a basic like resurfacing laser, if you don't want to spend a whole lot of money, I think it's great too. I like it. I know we don't have the cost on here too, but we can also do your décolleté region. A lot of women really like that because that's another spot I feel like in us that makes us look older than we are because of like being out in the sun and sun damage. So I really like that area too. I will open up. Does anybody have any questions at all? You guys are so quiet. Yeah.
Whether you're 1 or 4 times or however many times, it's the same price.
Each time, or you can buy a package. We have some package deals where you might buy 4 and then you save $200 on each treatment.
Yeah.
With regard to the treatment for the fine lines, compared to like the fillers?
So I actually think because this is a treatment laser, I like this over fillers. Because if you take good care of your skin after we do all your laser treatments and we hit that endpoint, we're like, hey, we're both happy, you have the results, we're good. Since it's treatment, and as long as you're wearing sunscreen, moisturizer, a good skincare regimen, it's there. It's not gonna like just come back. With fillers, you have to keep using them over and over again, and then over time, your body metabolizes them, and everybody metabolizes the fillers differently. So some people are like, oh, I come like every 6 to 8 months to you, or I come every year to you. Instead, this is like you're treating it. Instead of just like treating the symptoms, kind of, you're treating the wrinkles and getting rid of them. Yeah.
Patients who have a lot of actinic keratosis or seborrheic.
Yes, that's perfect. That's like send them to me. Like that. It's great because it's like instead of having telling them, oh, make sure you're using like your 5FU cream all the time. You can basically treat the laser with this. The one thing that we don't know is we don't know how many times we should be hitting them. I kind of would go off basically how much we've resurfaced their face, and if basically those lesions are resolving with one treatment, then you treated it.
Can you explain what her question was?
Oh, yes. So she was asking me about something called actinic keratosis. Those are premalignant lesions. When you feel like roughness on your face that's not going away, and because we live where we live down here in Georgia, it probably is actinic keratosis. It's a very rough feeling lesion the one thing is I don't think the seborrheic keratosis, I don't think it treats that. That's more that stuck-on appearance lesion, but it does treat the actinic keratosis where it's like rough. So if your physician or your dermatologist told you have a lot of like premalignant stuff, I'm going to treat you with, we're going to buzz it with stuff, or we're going to treat you with like creams, this takes the place of that. And what's nice is sometimes when people buzz you, that can scar. So that's the only benefit of this too, that it's superficial, and so you're not taking like a Bovie or a heat source and pushing it into your skin. It kind of makes it all slough off, and so it treats it that way. Yeah, that's a good question. Did that help? Did I answer? Okay, good. Okay, good. So yeah, actinic keratosis, another term, that's just a premalignant lesion. A lot of our lesions are that before they become basal cell or before they become squamous cell.
So if you use this laser for something like that instead of like a 5FU cream, is it covered under your insurance?
I don't know. I know that's a good, I think right now this is probably still considered cosmetic. I'm sure we could always try and ask. But I'm thinking right now it's probably always going to be cosmetic just because of how they market themselves as a cosmetic procedure. I don't see why though it couldn't, because to me, scars can be like devastating for patients. To me, that's not a cosmetic treatment. You're like helping them. So, but a lot of insurance companies I don't think would recognize this as function. I think they'd recognize it as cosmetic.
Even with the premalignant status?
We could always try. Well, I haven't come across that yet, but that'd be interesting to I'll ask my rep and see if anyone's fought that to see if we can. That's a really good question. Yeah. So, yeah, Kim remind me to do that. That we need to ask if insurance will cover this for premalignant lesions.
I mean, it's cheaper than waiting until it's cancer and then we have to treat it with radiation.
Yeah, no, it is. It absolutely is. It is, yeah. And then people don't want to go to surgery and then get radiated and yeah. I've been sending patients to you after I excise stuff, so yeah.
Do you do the face and the neck at the same time?
Yeah. Yeah, you can do face, neck, and décolleté all at the same time. It's up to you what you want treated. Yeah, you can do it all at the same time though. Yeah, you could do face, neck, décolleté, hands, arms. Yeah. I know when I was in training, we did a lot of burn scars with it that weren't hypertrophic though, but that we used this on, and it really helped a lot of our peds patients that I saw. Okay, and then does anybody have any questions about what I do? Just in general. This is part of it, but it's not all that I do. Does anybody have any questions kind of what I do? I do both, because I know a lot of you have heard me speak before, but not only do I do cosmetic stuff, but I also do reconstructive stuff. So one of my passions is actually reconstruction for breast cancer. So I do a lot of that as well. Yeah.
Question. Do
Mhm.
That's what I'm interested in.
Okay.
And then my girls, they're like 49, 51, and 57, and they're getting that stuff too. So they're like, Mom, take notes.
Okay. So it offers some skin tightening, but I wouldn't use this as like the sole treatment, meaning if you only wanted skin tightening, I wouldn't do this. Because I feel like that's going to be a waste of your money if that's what you're looking for, because I don't think this can tighten enough when you have excess skin. Really, to really completely get away of excess skin itself, if you have a little bit, I actually have something called what's called Vaser. It's Vaser liposuction. We can lipo you down, and because it's a heat source, that offers skin tightening, and I see a lot of good results with the Vaser. Another option is if you have no soft tissue there and it's just skin hanging, that would require like a neck lift to completely get rid of it. Yeah, yeah, absolutely. Yeah.
So for like mommy makeover or having her after you had a bariatric procedure, how long?
Oh, how long after? That's a really good question, because I feel bad because sometimes I feel like patients are coming in and they're not quite there yet, but like it's still good to educate people. So for insurance, I always try to go everything through insurance when we can. But also me personally, just what I learned is you always wait 1 year after your bariatric surgery plus 3 months of stable weight. So the earliest I would do surgery on you is 15 months after your surgery, just because your body is constantly changing. I mean, some people are still saying weight loss up to 18 to 24 months after their surgery. To get your best possible outcome, you want to wait till your body weight is stable. So insurance companies want to see at least 3 to 6 months of stable weight, and then it has to be a year after your surgery. And for me, just because what I've been exposed to when I did my training is you definitely want at least to wait 15 months, because your weight, not even if your weight is changing, but your composition of your fat and your skin and the tone of your skin, that changes too with weight loss. So you want to wait till their whole body's stable. Good question.